Hi y'all. So let's take you through one round of my rehab program. Again, we're talking about the first 2 weeks potentially of your rehab program. These are suggested ranges, but everybody's different, so you got to take your own injury and you got to take your own program and you got to go day to day and you got to assess where you're at and make these adjustments that are appropriate for you. Again, this is my first 2 weeks. I'm at day 9, and so going by both recommendation and by feel, this is where I'm at today. So my 4 base program exercises in rehab are having my leg in a supported position and doing quad tensioning exercises. So my prescription says up to 20 reps. As often as I think about it, tense the quad, hold the quad for a 5 count, and then release the muscle to relax. Tense the quad, hold for a 5 count, okay, and release the muscle after 5. So I'm doing some of those reps where I intentionally draw the toes toward me as I tense the quad, and I hold for that 5 count. And I'm doing some of those reps where I point the toe away and I tense the quad. It's not changing really much for how much tonality and muscle activation I'm getting at the quad. What it's doing is it's giving me more options, just like my normal exercise program would have. And so calf raises are something I've added to the program which aren't causing me any discomfort. And so calf raises, I need plantar flexion. Some of the mobility exercises I'm practicing in my normal program also are going to require me to have some plantar flexion. So again, I'm mixing my ankle positions for my 5 rep contractions. Let me do one more here. I think this is about maybe 6 or 7 reps. Again, I'm just holding for about a 5 count, either toe up or toe down, and then I'm relaxing. And that really does 2 things. It's creating tension in the quad, so it's keeping this muscle group active as it's going to present tension into the knee. And I would say that I get no pain from that exercise, and really haven't had pain in that exercise from day 3 when I started doing them. Some stiffness, but not pain. Okay. It helps to get the knee a bit more straight. Maybe not easy to see in the camera, but I can sense that my knee has dropped just a little bit from the start of that. Okay, second exercise as we go through the list, and I have been keeping this order for this 4 exercise lineup. It just feels like it's a nice pattern to repeat in this way. So the next one is going to be heel drags, and so we just activated the quad by getting that knee to flex, to extend, excuse me. Now we want to flex the knee, and so we want to activate the hamstring. So we're putting downward pressure with the heel into the floor, and then we're dragging the heel close to us. And if you were checking in on that previous video I had posted, I'm not chasing 90 degrees. So I'm visually looking down, use my hand to give me a visual. Okay, that would be my tip fib, hitting 90. I'm not chasing 90 yet. I will in the future, but I'm not pushing for a big degree change in my knee. What I am pushing for, though, is increase activation of my hamstring. I want to feel this back here tightening up. And my stopping point has been either 90, if I get there without discomfort or pressure, or assessing pain or pressure in my knee. Okay, and so I will say that my first set's a lot different than my second and my third. Okay, if I do a 4th, which I've done, and a 5th set, every set I seem to more comfortably get a little closer to 90, and I've gotten to 90. And so I'm just not holding the expectation my first rep's going to get me there, but I am holding the expectation that, if I continue to feel good, and I'm not questioning and pushing myself here hard, but if I do feel good, I will let that knee close ever so slightly. And so let me do a couple more just for the demo. Again, I'm doing up to 20 reps for these sets. So it does take quite a bit of time. If I'm doing 20 sets and I'm doing 3, 4, or 5 sets. And I've also, which I might have mentioned, the frequency in my day and the number of reps the number of sets that I'm doing is really based on 1, how I'm feeling, 2, how much I've walked. So days I've walked a little bit longer in my practice here, just to kind of see what my knee is tolerating and how well I feel, I've done fewer sets of these movements, but I've tried to keep it at 20. So my discipline and accountability to 20 reps has remained. Okay, my third exercise are the ankle pumps. And I'm pretty much doing these with my foot down on the floor the whole time, and I'm showing two different ways. One, I'm letting my knee subtly change angle, so I have a passive knee, my quad and hamstring are loose. I'm just pumping that ankle. That's the first way I'm doing them. And this causes me zero pain at all through the amount of angle you can see in my knee. I can bring my heel slightly closer and let that subtle change in knee angle happen from a more closed knee position, or I can have the knee more extended when I do it. You know, all three positions kind of out in the middle and short. They're all fine. So I'm doing all three, but I've also, I showed in the other video, I'm doing reps where I'm holding the knee in extension, I'm keeping the quad tensed, and I'm doing some of those ankle pumps. You see that foot? And if you're familiar with ankle cars, okay, doing different types of ankle circle exercises, where you're making sure that the lower leg and the femur aren't rotating, it's just isolated to the ankle. Again, that's not something that is causing me any problems, and I have explored doing this throughout the day. I am catching myself doing this more when I'm just standing and not during my 4-set exercise rehab program, but again, this is something I am incorporating. It's something I typically do daily anyhow. Okay, and then the last of the exercises in this 4-exercise routine, and again, this is the basic list. This is just the paperwork I've gotten from PT post-surgery, and I've been doing them, you know. I can't say that it hasn't been hurting me. I think it's helping me. Have I gone a little bit outside the box and created my own things? I have, all right, but I'm not showing you that just yet. So I take my weight, and this is just between 5 and 10 pounds. That's shown to be plenty. And I just put it close to the knee to help the knee joint get straight. And I'll do a little bit of toe up, I'll do a little toe down, I'll do a little quad tensing. And, you know, also thoughtfully positioning my legs. So right now, I've got the heel off the bench. And I'll let that sit for just a moment. I'm not gonna let it sit for as long as I would in my own time, but for the video, I wanna show you, but not take too much time. So anyhow, with the heel off, okay, that's gonna be one position that I'll explore. Again, weight can be above or below the knee, or the way that some of these adjustable dumbbells are set up, I can space it over the knee and it doesn't make contact with anything that's a bit still fired up from the surgery, so it disperses around that knee joint nicely. I'll back up. Now the heel is on the bench. It gives me just a bit of an increased awareness and angle at that knee joint. Let it get on there and help support that knee down. Yes. Again, let that settle in. And again, out of all the things I've worked on so far, this one seems to be what gives me the most awareness that I've got some things happening in my knee, right? Other than trying to bend my knee more than 45 degrees loaded, trying to walk upstairs, trying to walk at my normal cadence, because I'm getting back to walking with almost a normal gait. As long as I go slow, I can go a nice heel toe on that left side. This is the only exercise that causes me a little bit of discomfort. And I can feel that this knee doesn't want to get completely straight. And I've experienced this before with different ankle injuries, and I had a knee injury in the past on my right side, not a meniscus injury, a different one, but stiffness is common with bigger injuries that take a longer time to rehab. And so I'm expecting some discomfort around getting my 4-range of motion back. And again, I'm trying to be patient, I'm trying not to force this. So anyhow, knee, heel on the bench with the weight close to me. And then getting as much now, I didn't do this the first several days getting into these exercises, but once I crossed the week, I thought I should go ahead and ramp it up a little bit and just, again, see how I feel, and if I'm feeling good, go with it. So now I'm beginning to elevate even more, so I'm placing objects under the distal end of my leg, and then taking weight and setting it close to the knee to really let that knee fully extend. Now look, if you've got some muscle mass on you, your calves got some good thickness to them, or your hamstrings got some thickness to it, Is it likely the true back of your knee will touch the bench? Not necessarily. You know, if you've got a lot of muscle mass, it's gonna hold us up off the bench. And that can create maybe a false presentation of, is my knee getting as straight as it should or could? Or is it really just because I've got so much size here it's keeping me elevated off the bench? And so that's something to be conscious of if you're playing around with these types of exercises. I'm not trying to achieve hypermobility. I don't want my knee to become, I guess, concave. I don't want my knee to be concave. All right, but I also don't want it to get frozen or too stiff in this convex shape in a flexed position. So anyhow, this is the third position, and I mentioned it does cause a little bit of discomfort. The discomfort's not anywhere in the meniscus, thankfully. And I don't really feel pressure in the knee like I do when I flex the quad to get the knee straight. What I feel is this area back here. It is medial. It doesn't feel like it's down into the thickness of my hamstring, more close to where the attachments are, but just off the inside of the knee, back of the knee, I feel this area stretch. And when I release out of this position, it feels stiff as it wants to go back to a shorter position. So anyhow, those are the 3 positions that I use for that exercise, and those are the 4 exercises that I use. Additionally, I've added some calf raises, and those are coming in all variations. Those are coming with my feet just together, you know, like a toes together type of an idea, you know, any type of angle. It's all been no problem. I'm doing some with the knees as straight as they'll go. I'm doing some with the knees bent a little bit. All that feels so far good and safe. That's pretty much been my lower body program. Oh, I guess I have been doing a little bit of single leg balance work, but I haven't attached anything to my ankles. I haven't done any abduction, adduction exercise. I haven't targeted hip flexion, although it's not a painful move, but I really have not done that. Hip extension, I haven't spent time focusing on yet. I really just reserved my attention to the base 4, and like I said, I added some calf raises, and as I was talking, I remember, oh yeah, I am spending a little bit of time standing on one foot, so some single leg balance, but that's sort of the end of it. Day 9 check-in. You know, pain is very minimal. That's still the exercise program. I'm not gonna change much, going all the way up till my next appointment, my check-in appointment with the doctor. Letting them guide me. Again, I wanna mention this is my first meniscus surgery, and I haven't worked with clients with previous meniscus surgery. So, again, if you've got any insights on how you therapied yourself, or if you think there's anything that I should try that I'm not trying, please send it my way. You know, I'm always open to learn. I'm checking out resources online to see what people are doing. You know, different types of massage work I'm not mentioning. I'm doing a little bit of that throughout the day just to help with circulation. But anyhow, things are going well. So keep checking in with you every couple of days, and let me know what you think. All right, see you soon.